those questions. A very, very important topic tonight. So let's get started. Let's dive right in. My name is Sierra Bragan, and I'm thrilled to be your host tonight. The Parental Guidance webinar series, like I said, has become near and dear to my heart. The Jackson team reached out to us almost a year ago to join them in this initiative to bring great resources to families, to individuals, really in Miami, but now thankfully, because of our virtual option, we can reach people all over internationally as well through these webinars. But it has truly been a delight to cover a number of topics with all of you and with amazing panelists along the way. So again, I represent Miami Mom Collective. Our heart and mission is to encourage, equip, and empower moms and families in Miami. So if you or someone you know is a mom, then send them our way. We've got events, resources, and all kinds of things to help them in the motherhood journey. So I'm thrilled to tell you more about Holtz Children's Hospital and Jackson North. Did you know that there are pediatric emergency rooms at both locations, and they're available 24/7? So they're all staffed with board certified pediatric emergency medicine specialists. So kids and parents are also getting access to every pediatric subspecialist from the University of Miami Health System and Jackson Health System if you go to the Holtz Children's Hospital. So that's something I didn't realize is you're not just going to a hospital and getting some care, some great care, but you're getting access to the very, very best care across all those systems. And the Holtz Children's Hospital also offers a 24-hour kids only emergency room. So especially during this time, I feel like that is hugely important to know that if there's an issue with your child, you can go somewhere where you're not going to be exposed to all the other things that typically happen in, an adult ER room. So wonderful that it's a 24-hour kids only room. And additionally, at the Holtz Children's Hospital, the doctors and nurses are all certified in pediatric advanced life support. So again, you're going to get the best care that you can get. So we could not do this whole series without UHealth Jackson Children's Care. So we're so thankful to them for orchestrating this time and this place for us to gather. I'm really, really excited about the topic tonight because I think it's very important all the time, but especially in the season that we're walking through. So tonight we're going to dive into managing grief and loss. Probably not the easiest topic that we want to dive into, but we need these skills. We need to have these questions. So I'm thrilled to introduce you to Dr. Clara Laura Ospina. She is the director of the Psychology Internship Training Program and the clinical director of the Adult Outpatient Center for Behavioral Medicine. And that's at Jackson Behavioral Health Hospital. Her areas of interest include, listen to this because there is something for everyone. I was reading this list and I thought, okay, I have questions about all of this, but her areas of interest are PTSD and other anxiety related disorders like depression, marital discord, bereavement, adjustment due to loss, and then issues pertaining to infertility, chronic pain management. These are things that I don't think about, chronic pain, like how that goes with grieving and loss. So these are important things, end of life issues, as well as just situational stressors. So I think probably all of us can find one thing on that list that we say, man, yeah, I definitely have experienced or am experiencing, or one day will probably experience grief and loss in one of these issues. So I know Dr. Laura Spina will have lots to share with us. Additionally, she was a clinical supervisor at Boston University's Center for Anxiety and Related Disorders and the Psychological Services Center. She was also very busy, apparently, but an adjunct professor at Emmanuel College in Boston. So she did amazing work in the private sector there. And then she returned to Miami in 2014 to start her own practice in the Gables. So she's fully bilingual, and her interests include facilitating groups in relaxation skills, anger management, pain management, mindfulness. Goodness, we have a lot of questions for you because you have a lot of areas of expertise. Dr. Laura Spina, welcome. We are so glad to have you tonight.
Thank you so much for having me on. I'm so happy to be here. And like you said, talking about this topic that is sometimes taboo and not really discussed, but that touches all of us at any given point in our lives.
That's right. That's right. And you make a good point. Not only is it taboo as an adult, but I'm a mom of small children. I know a lot of those listening have children as well. And it's something we don't even think about sometimes discussing with our children, or we shield them from it. So we're really going to dive in tonight. We've received some great questions. I can't wait to go through those. If you, again, those of you listening have a question at any time, drop it in the Q&A box. I'll do my best to get all those addressed to Dr. Laura, but we are going to just dive right in. Can you tell us, let's talk about grief kind of holistically first. Do children grieve the same as adults?
The quick answer is no. And I do want to give just again an overview of grief and the way that I how I approach the treatment of grief. And this is a model not that I came up with, but it's the model that I follow, and it's basically the 5-stage grief model. And so in this, I think it can be really helpful to help people understand what to expect when you're grieving, because grief isn't just sadness. Grief actually goes through stages, with the first stage being denial. So if you have ever experienced a loss, it's that point where you're like, this didn't happen. I can't believe this happened, right? No, this didn't happen. I'll wake up tomorrow thinking this did not happen, right? And then there's anger. We get very angry at what happened, angry at somebody, maybe angry at the person because they were driving distracted, or angry at the person who smoked and then got cancer, or anger at God, which is a really complicated one to deal with. Then we go through the stage of bargaining. This is what we also call the undoing stage. This is kind of that magical thinking that, if I'm really good today, or if I just kind of pray hard enough, or if I'm really kind to all the people around me, then I'll wake up tomorrow and all this will have been a nightmare, just a bad dream, and everything will be okay. Bring that person back. I give it all my money to just get that one hug, or that one kiss, or that 1 hour with that person, the bargaining stage. That's one of the most torturous stages. And we tend to spend quite a bit of time in the bargaining stage often. And then after we pass the bargaining stage, which obviously is not successful, we hardly ever, never successfully bargain our loved one back, then we fall into the depression. So that's kind of the common one that we all know of, right? The depression stage. And then that lasts, however, as long as it lasts. And then the ultimate, very final stage, what we're working towards when we do grief work, is a point of acceptance. And acceptance doesn't mean that you're okay with what happened. It just means that it happened. And that you've got to live with it. Happened. And we don't exactly progress through the stages like in 3 months that you do this, and then another 3 months you do that, and then another 2 months you do that. No, as you can imagine, we kind of pop in and out of the stages. But the entire, what we're trying to do, whether you're working with somebody or whether you're doing this on your own, is at least move forward. At least know that you've got to move forward. Problems arise when we get stuck at any given stage. And just to give you a little bit of context, most grief takes about 1 year. So kind of a simple grieving event, if you will. And we can talk a little bit about what's a more complex grieving event and what's a simpler grieving event. But a simpler grieving event takes about a year to go through these stages.
Wow.
And so children, the thing with children is children are...
Go ahead. Sorry. I think with the lag, I interrupted you. I'm sorry.
I know, it's okay. And so just to answer the question directly, in children, you will often see denial, depression, anger, and you don't really ever know if acceptance, it just kind of extinguishes itself, so we really see the denial of like, what does that mean, right? The denial is more a lack of understanding than it is a denial. And then it's an anger and a sadness. But sometimes parents are confused because children maybe don't express sadness, they don't express it, but they'll misbehave, or they sometimes regress in stages. And so it shows up in different ways.
Wow. Okay, that's good. I've heard of the 5 stages before, but I've never thought about it in children as manifesting in kind of like a different order. Like that's really key, I think, to watch for with our kids as well. Okay, say the 5 stages again. So it's denial, and then this is good for me to say it because it's helping me remember. Denial, and then anger,
denial,
bargaining, depression, acceptance.
Acceptance, exactly.
Okay. Okay. It helps me to do this because that helps me remember.
Yeah,
And that's interesting yeah, it does manifest different for children. So of course, yeah, they grieve different. What about children of different ages? And I will say already we've received, some questions, mothers and tween daughters. It's kind of like, okay, that right there is probably a reason for grief some days. But
yeah,
dealing with children of different ages, do we talk to all of the kids about grief
yeah.
and loss in the same way? Or like how do we have those difficult conversations?
So I will tell you a little bit about myself also real quick is I am the mother of a 8-year-old boy, and I'm the stepmother to two wonderful girls who are now 18 and 16.
Okay.
And I would not talk to all three of the children the same way.
Right.
So I would not talk to children the same way because what one of the things that we need to do is we do need to be honest.
Mhm.
And we do need to be, kind of simple with our language, but we want our language to be age appropriate. And so one of the things that I would recommend is that you that you spend a little bit of time with each of your children, even if they're close in age, that you initially spend a little bit of time with each of your children. Even if the initial tell is kind of a family tell, then you spend a
Right.
little bit of time with each of your children. Um, More listening. In the
Right.
initial stage is more once you've had the opportunity to tell what happened, right? To tell about the loss, it's more tell me what's going on for you. Tell me
Mhm.
what's going on for you, and we want to answer the question. One of the best ways to approach grief in children, and this is of any age, is to answer their questions. And that what really helps there is that their questions are going to be age appropriate, and so the
Right.
information you give is going to be age
That's good.
appropriate. You know,
That's good.
yeah,
Yeah. That's a great tip too, to start with the questions, because I know as a mom and I'm a talker that I can just like go at them and just start
yeah,
telling them. And then I'm like overloading them with information they don't need in probably not age appropriate ways. But to sit there and draw them out with those questions that's just so key. Yeah, that's good. That's good. Yeah, I'm seeing even in
absolutely.
the comments, a mother of an 8-year-old boy whose father passed when he was 2. Like how, oh, that's so challenging, and how you talk through these things. Wow, okay, there's so much here. I get excited because I'm like thinking of so many questions at once to ask you, but we're just gonna keep walking through it. So tell me, should we I feel like I know the answer to this, but elaborate on how we should do it. Like, should we protect our children from grief, and should we keep grief and loss private? I'll give you a personal example. So I had a miscarriage last February, and my kids at the time were, almost 3, and, I mean, little, like 1.5. So he didn't really understand much. But I wrestled with like, do I even tell her about this? Do I tell her later? Like, what would be your advice for, do we share? Do we keep it private?
Well, again, and grief is just with everything else is not one size fits all. So let me do a very therapy person thing here right now. But tell me what you did do, Sierra. How did you approach it?
Yeah. So we, obviously, because I had to go to the hospital, spend a day or so. So when we came back, we just told her, God put a baby in mommy's tummy, but God has taken the baby to heaven, and so we just kind of made it age appropriate for her. And we never told her it's a boy, it's a girl. But even still today, that was a little bit kind of all that we said about it. And, we talked about mommy's, is healing up and this kind of thing. And then I was pregnant a few months later. So then we talked about there's another baby in my tummy now. But interesting enough, even still, she talks about,
Yeah,
oh, my sister is in heaven, or my sister's with God in heaven, which is what we told her, but she's made it the sister. So she's taken it on. And
right.
that's kind of all she shared about it.
Yeah. Well, and was it a sister?
Yeah, see, we don't know. And we tell her, we're like, well, we don't know. Like maybe it was a brother, maybe it was a
Okay,
sister,
so
because it was very
right.
early. So
Okay, so
yeah.
yeah, yeah. Okay. And so this brings up a couple of points that I wanted to touch on. One is that so you said, for us, I talked about kind of the timeline of grief. grief never really, the loss of a child, there are certain losses that never really go away, if you will, so that
Right.
they stay with us pretty much for the duration of our time here on earth, you know.
Mhm.
um
Mhm.
a miscarriage, the loss of a child, those are the types of losses that tend to stay with us
Mhm.
forever, right? The relief from the really significant pain often comes about 5, 7, 10 years later.
Right.
But for your child, I think you did exactly what I would have recommended, which is you talked about it, you discussed it, and you said, and you put it in words for her, again, in an age appropriate way. What
Right.
she demonstrated, which is interesting, is one of the points that I wanted to make with children, is that children take this idea of loss, and they can extend it
Yeah.
way more than we would
Mm.
think a child could kind of possibly remember for certain
Right.
things,
Right. Right.
so she may be bringing it up. And she might bring it up at odd times, right? Again,
Right.
because
Right.
she doesn't have that socialization. It hasn't been socialized to children that grief is one of those taboo topics. And so you'll
Right.
be in the middle
Right.
of a birthday party, celebrating somebody's birthday, and maybe your daughter will say, "Oh, my sister would have been 10 today also." And you're like, "Oh,"
Right.
you
Right.
know,
Oh,
um,
wasn't
but
waiting for that comment. Yeah. Yeah. Wow. That's
it's
good. That's
possible,
good.
I mean, probably by the age
Yeah.
of 10, yeah. Yeah, probably by the age of 10, she won't be referring to it, but children will continue to refer and refer and refer. And so one of the things as parents that we need to be aware of is that we need to be really patient with them, because they will
Yeah.
just keep bringing it up. Anything that reminds them of that person,
Yeah.
when we're reminded of the person that we lost, we'll tend to keep it quiet and kind of
Yeah.
more
Yeah.
keep it to ourselves. They are more externalizing. Yeah,
Right.
they're more externalizing. So they'll say, "Oh, this was grandma's favorite restaurant. Oh, and this was grandma's favorite pen, and this was grandma's favorite soup." And you're just like, "Oh
You're
my
like,
gosh, enough, enough." But
yeah.
but we can't, right? We've got to be really, really patient, because that's how they want to remain connected with the person that they lost.
Right. Right. Yeah, oh, that's so good. We're getting so many questions are coming in. It's great. You're really resonating with people, and it breaks my heart because so many people have encountered loss this year, and I think collaboratively,
Yeah.
in some way, just the weirdness of the year, where we've got this collective grief thing going. But talk to us about. One mom asks, how early is too early to talk to your kids? Is it ever like kind of too early, or just as long as you're making it age appropriate? What would you say?
Yeah, in terms of too early, in terms of age, I mean, if the child has language, then the child has understanding of language.
Right.
And so, yeah, just make it age appropriate. And again, really focus more on, instead of the tell, right? You will do the tell. And then the tell is, again, using simple, thoughtful, but direct and honest language. So it is better to say, so and so died.
Yeah.
Because if you say things like passed away, they might not understand, like passed away, passed where? What does away where? Away means maybe they'll come back, they'll
Mhm.
return, things like that. So,
Mhm.
they died. Um,
Right.
I tend to, talk about kind of the circle of life sometimes with kids, because things that maybe they might have seen in movies, they're going to try to make a connection to something that's familiar to them. And so, um, just be direct and honest, and then make the tell short, but then spend the time to answer any
That's
questions,
good.
to ask, how does this make you feel? And then, do you have any questions for me? Is there anything you want to know?
That's good.
you know
That's good.
and then with that, it's, so how did they die? Maybe why? Because maybe children, if they're too young, they might not know exactly to ask how, but they might, why did
Right.
so and so die?
Right.
And so that's where you might say, they were sick, or there was an accident, or things like that. Now, I know
Yeah.
you said to your daughter, God took, the baby. That's fine too, because there really was no explanation. You don't know why.
Right.
you
Right.
know
Right.
and so we don't want to make stuff up. Yeah, we don't want to make
Yeah.
stuff up. But we also don't want to fill their heads with kind of fantastical ideas,
Right. 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 Right.
if that
Yeah.
makes sense.
Yes, it does. And I loved what you said about keeping the tell short. Because again, I know that I can be like, in order to avoid an awkward situation with the child or to helping them understand by just going on and on and on and on and on, when honestly being a shorter tell and longer for questions and opening up their end to talk is really, that's really wise and helpful. That's great.
Yeah.
A few questions from our audience,
Yeah.
and some of them may be a bit specific. So, Clara, I understand if you can't get into like specifics, but some are saying like their children are experiencing anxiety because they lost, a grandmother. It was a sudden death about 4 months ago, but like now, how do we help with the daughter with the anxiety? Like, is that anxiety probably a manifestation of the grief?
It very likely is. And I would like to know, what the anxiety is about, because usually what happens after the first significant loss is that then children now are familiar with the concept of death. And so
Right.
that is after, and that this happens to most of us. At whatever age we experience death, the later it
Hmm.
is in our lives, the more we've heard about death or heard about people dying or know what death is about and know what it can happen and things like that. But with children, the minute they hear death, then the very kind of next thought is, am I going to die? But usually it's actually,
Right.
are my parents going to die? Right? Who's the next
Yeah.
person that's going to die? And especially if it
Right.
was a sudden death. So some of the anxiety that arises in children after that first loss, especially if it was an unexpected loss that we could not prepare for,
Hmm.
is this question of, people die, who is the next person that's going to die? So some of the
Right.
anxiety might be coming from that. So i would
Mhm.
i would encourage I would encourage you, mom, to ask your daughter, are you afraid that something's going to happen to somebody else? Tell me if you're afraid that something's going to happen to somebody else. What do you think might happen to somebody else? And let's talk about, death. Kind of, let's talk about death.
Right.
There's death we can prepare for, there's death we cannot prepare for. But it is not unusual for children to experience an increase in death anxiety after
Mhm.
experiencing, again, especially a death that they were not able to kind of prepare for a bit.
Yeah. Yeah. Okay, great. That's helpful. And yeah, if you're
Yeah.
listening in, we know that there's a lot of different ways that we grieve. We're camped out a little bit right now on the death of a loved one, but we are going to touch on the topic of divorce and another thing. So stay with us if those are your questions as well. But what about, I'm going to combine a couple of questions here, but like, is it okay to cry and be sad in front of your child? But then also, is it okay if you just need time to, grieve quietly or alone? Like, is there, talk to us about, grieving quietly versus grieving more openly.
Yeah. So, and that this is a really, really important question. I'm so glad you asked it, especially in a virtual room full of moms, because we are very altruistic. And dads are great and all that, but moms are, we are much more altruistic. We are the ones that look around and kind of need, want to know who needs taking care of before we take care of ourselves. And
Right.
it is really important with grief, as really with anything, but it's really important with grief for you to be able to grieve yourself and to
Hmm.
grieve in a healthy way yourself, to not set aside your feelings and emotions for what you feel is the sake of not scaring your child, or not having your child feel sad or whatever.
Hmm.
Now,
Hmm.
you do not want to be probably hysterically crying every day in front of your child,
Right.
but it is absolutely, absolutely perfectly not only okay but healthy for your
Hmm.
child to see and to understand that you are being affected and how you are being affected, that you are
Hmm.
sad, that it is okay to cry when you are sad. We model this behavior for them. And so then we then will get that back from them. They will be able to be open with us when they are feeling sad and when they're feeling whatever kind of emotion. So it is perfectly okay for you to cry in front of your child. In fact, children are very perceptive, as we all know, and they know when
Hmm.
something's up. They know when we're hiding something from them, especially if it's
Yeah.
something emotional, because we're not going to be
Right.
ourselves. We really are not going to be ourselves.
Right.
We think we're doing a great job at hiding it. We're not. We're really not. They know
Right.
something's up, and they're going to want to
Right.
know what's up. They're going to want to
Right.
know what's the
Yeah.
other thing in terms of kind of grieving, there's two kind of models within the grief, right? That is, everybody needs time to grieve by themselves, but then I also recommend that people also grieve as a unit, as a family. And so it's okay, let's say, for
Mm-hmm.
each child to have their moment where they grieve by themselves, but do try to create moments where maybe at the dinner table we say a prayer because we lost this person. Or maybe we go to the park one day and we sit around and we just kind of think about this person, or we look at pictures all together
Mm-hmm.
and we tell stories about this person. So we want to have both of those
Right.
processes happening simultaneously. The one where people get to grieve by themselves, but also the one where we get to
Right.
grieve in community, grieve as a family.
Yeah.
And if I may add, this notion of grieving in community, it's so important that we not hide our grief from the outside world, right?
Right.
Tell
Mm.
teachers, tell coaches, tell
Mm-hmm.
friends, tell their friends' parents, basically tell everybody that is
Mm.
a part of your, weekly kind of contact. Let them
Yeah.
know, because I can't tell you, speaking to teachers, how many teachers come to me and say, I had no idea that this had happened to
Mm-hmm.
this child, and they
Mm-hmm.
were misbehaving or they were acting strange, and I kept telling them to sit down and be quiet or whatever, and I had no idea that this was happening in their lives.
Right.
So
Right.
share the information with your community for sure.
Yeah.
Grieve in community. So grieve independently, in family, and in community.
Yeah. Oh, that's good. That's good. Oh, that's one of the things
Yeah.
that I say constantly, even among our just mom community, is things done in community are so important because I just think there's strength, and for women, that's
Yeah.
hard for us because we add the ears and we divide the vulnerability. So we're not too good at that typically. But I love hearing from a professional. You're telling us that there's good in that. So,
Definitely.
okay.
Yes.
So many more questions. Clara, we're going to keep going. This is good. We moms have lots of questions, and those who are not moms. I know there's some here who probably aren't moms, but thank you for joining us. Okay, what about funerals? Should we take children to funerals?
Again, I mean, it's not one size fits all. In general, I wouldn't take very, very small children to funerals, just because, again, they don't have the understanding of what's going on. And probably the cutoff is, again, just probably, I would say, a child that can, ambulate on their own. Don't take a baby to a funeral. Or, I mean, I guess you can take a baby to a funeral because they're really going to kind of be oblivious. But you want to take
Right.
children to the funeral if they want to go to the funeral. And now this is a strange kind of
Okay.
if. We're not necessarily going to
Yeah.
ask. I mean, you are going to ask, we're going to have a funeral. They may not understand what a funeral is. So really you're going to explain
Right.
what a funeral is. You're going to say, this is,
Right.
you know, right. So this is where we're going to, go and pay our last respects. What does that mean? Well, we're going to go and we're going to maybe see, you're going to want to decide age appropriately, open casket, closed casket. I know, 19, 18-year-old children who would not, go to see an open casket. And I've
Right.
known, 3, 4, 5-year-old children. I mean, I'm going to age myself here, and this is even before my generation, but I mean, who hasn't seen the picture of, little John by his father, John F. Kennedy's casket, basically saluting the casket.
Right.
And he
Right.
was 2 years old, you know.
Right. Right.
So it's perfectly okay. It is perfectly okay to take children
Mhm.
to a funeral. You just want to prepare them for what is going to be happening.
Mhm.
You want to explain to them, again, in simple, age appropriate language, and not force them to do anything. So
Mhm.
if you want to go walk up to the casket and they don't, that's okay. If if there's going to be a burial, and your graveside, and the child says, this is too much for me, then we've got to figure out how to maybe walk the child back from
Yeah.
that.
Yeah.
So you want to stay kind of attuned. We all know our children pretty well. I think we know the capacity, but it's not inappropriate, and it's not traumatizing. It really all depends on your child. So to that question, I say, know your child,
Yeah.
speak to your child, and really take cues from them. Don't force them to do anything they don't want to do or they don't feel ready to do at
Yeah.
whatever age.
Right. I think you alluded to this earlier when you talked about when we were going through the example of miscarriage and how they can kind of extend that. But one of the questions asked was, do children bounce back from, a loved one's death faster than adults?
So they bounce back kind of in the kind of pure grief emotional aspect, but as we talked about, and bounce back, I mean, sometimes they don't even like, there's not even anything to bounce. Like you'll tell them, grandpa died or Aunt Lucy died, and they're like, okay, so can I go back to my video game kind of thing? And you
Right,
think,
right.
wow, but then they'll come back to it. They'll kind of keep coming back to it and keep coming back to it and asking you questions. What you want to do is kind of leave that door open for them to have those questions. So yeah, they do grieve a little differently. And in some ways they do kind of bounce back a lot faster, but then they also hold on to it a lot longer.
A lot longer. Right, right. Okay, good. Oh, there's so many questions and they're all so good. So I'm doing my best to get everyone's questions addressed. So hang with me. But here's one. It's pretty specific, Clara. So do what you will with it. But this person is saying that their granddaughter, so maybe this is a grandmother, but the granddaughter lost her mom back in December because the mom was, I think, killed maybe in a car accident or by a car. And this, I think, grandmother wants to know how she can help the granddaughter and her son through their grief. She's saying that she might not grow up because she wants to be with her mom. So she's kind of concerned about her mental health. And that she's also, I think this grandmother maybe has moved in with the granddaughter and her father, which is the grandmother's son, if I'm making sense. But do you recommend anything for like such a hard transition? And then, it sounds like too, it's a hard transition, but then there's a lot of family dynamics because then there's the grandmother on the other side who's also having a hard time with this grandmother living with that granddaughter, so a lot of these elements, like that's a lot of grief going on in a
Yeah.
lot of different ways. Is there anything you can encourage this sweet grandmother with?
Yeah, absolutely. And again, I'm sorry, I'll just kind of give a blanket. I know we're talking about grief, and I do want to, for all the people out there that have lost loved
Yeah.
ones, my heart is with you all. My heart is with you all. So the loss of a parent is another one of those very particular grief moments, right? The loss of a child for a parent and the loss of a parent for a child. That is the other loss that is going to stay with her forever, right? It's going to stay with those children for the rest of their lives. And so this is going to
Right.
take a bit of time. This is going to be those longer than 1 year kind of grief periods. This is a lifetime of grief that these young children are going to have.
Right.
So for grandma, one of the things, there's a couple of suggestions that I'd like to make. One is we want to maintain the structure of the home, but we want to be very, very thoughtful with these children. So we want to maintain structure in that it just can't be like a free for all because we're very sad for you because your mom died. So you get to do anything you want to do. No, you still kind of have to live up to your responsibilities. You must still go to school. You must still do your homework. And you are also in a very vulnerable state. So if you know if she's talking about things like I wish I was with mom, that's perfectly fine. That's part of that kind of bargaining, part of that undoing, that magical thinking that she's wishing that she wakes up one day and this hasn't happened to her mom. So I would not be too concerned about that unless she starts talking about how she might join mom. I want to, or she stops eating or showing more signs of depression, which is kind of a part of a broader conversation. But the things that she's saying are perfectly natural. It is so important that you tell the children's teachers, as I mentioned before, so important that you tell the children's coaches, the children's friends, and that they have plenty of opportunity to discuss or express, because they may not express it verbally, so it might be writing about it, it might be painting, it might be drawing, it might just be crying, it might be kicking, It might be screaming, how do we get it out? Because we feel grief in our bodies, just as we feel depression in our bodies and we feel anxiety in our bodies. We feel grief in our bodies.
Yeah.
Um,
Yeah.
but the children, we do want to treat them. We don't want to just brush this aside. This is a
Yeah.
very significant death,
Yeah.
and we don't just want to brush it aside. And to the other grandma who's jealous that this grandma's there, tough cookies. This is about the children. This
Right.
is a moment. This is about the children, right?
Mm-hmm.
And you as a grandma, I mean, you've lost a child, so you've got to deal with your own grief. But
Yeah.
this is one of those situations where we do need to prioritize the children's grief. And that's not to say that you can't grieve yourself, but we always want to kind of check in with them first because it's
Right.
such a big loss.
Right. Right. Wow.
I hope
Good word
that's
for her.
helpful.
Yeah. Yeah. And a big hug to that amazing grandmother, all of you. Like, Dr. Laura Spina said, our heart goes out to everyone grieving in different ways. Goodness. Yes. Along the lines you talked about, letting people have space to grieve, but also grieving, collectively and, collaboratively. One mom is saying her tween daughter doesn't want to talk about it, so she locks herself in her room. Should she continue to approach her, or should she leave her alone? Because the mom's like, I don't want her to feel like I don't care, but how do I kind of give that space but also still pursue?
Yeah. So and with teenagers, it can be challenging because teenagers are in this stage where they're like push pull push pull push pull. And
Yeah.
so you do want to, it doesn't hurt to ask. You're not gonna hurt a child by continuing to say it, just double checking, making sure you're okay. How are you doing?
Yeah.
It's better to ask and get the, oh yeah, leave me alone, I don't care, whatever, than to
Yeah.
not ask, because then the child does feel alone. And there is a
Right.
certain loneliness that comes with grief, usually
Mm.
because we're experiencing it and then life is going on around us as if nothing has happened, because
Yeah.
in fact for other people nothing has happened. And so
Right.
we feel,
Right.
and that's part of why we feel so angry, right? Like people are laughing. So this girl, her daughter maybe could be in class and her friends are talking about going to the mall or nail polish or whatever, and she's
Yeah.
like, that doesn't matter to me.
Yeah.
I'm sad or I'm angry. So
Right.
my suggestion would be keep asking, maybe check in once a week, maybe
Yeah.
not every day or every hour, obviously that's a little much. So
Yeah.
give a little bit of that space, right? Know that there's the push pull, and when you ask, regardless of what the answer is just let her know, I'm here if you want to talk, I'm here if you don't want to talk, and you just want to sit, I just want you to let you know I'm here for you. So
I'm here.
really the
Right.
reason I'm asking is because I want you to know that I'm here for you when you're ready.
That's good. That's good. Just to continue to reinforce that. Love it. Great advice. Great advice. Okay, we're gonna shift away from death here for just a minute in just a second, but another kind of specific situation. This person is asking, how do I explain to my son? He's only 4 months right now, so later in the future. But how does she or he explain to the? Well, I guess she explained to the son that his father was killed when he was 2 months in utero. So this woman was 2 months pregnant and the father was killed.
Mhm.
And how do I build a bond between the son and his father when they've never met? I can't imagine the grief there.
Yeah. So I would start with pictures. I would start with pictures, and I'm sure there are pictures of your husband, around. And so this is daddy, this is daddy, and this is daddy. And so at some point, again, the question will come up. So this is
Right.
not something that you need to address until the question comes up,
Right.
of where's daddy.
Right.
Eventually the question will come up, where's daddy? And then at that point, at whatever age that is,
That's good.
we will talk about what happened to daddy in an age appropriate way, depending on what the age is. But you want to
Right.
refer, to daddy or papi, or in whatever way, keep that person kind of included. You don't want to overly include him, because then it's kind of loss on top of loss, right?
Mhm.
Somebody who isn't there, that we now have to tell you isn't there and have to take away because we brought him in, if that
Right. Okay.
again makes
Yeah.
sense. So we don't want to
Right.
we don't want to turn it into complicated grief, complex grief.
Okay.
And so you might refer to daddy again as the picture, and he'll ask, who's that? Oh, that's
Yeah.
daddy. That's
Mhm.
daddy. So I would start introducing the pictures, and if you've already introduced pictures, well, no, he's 4 months old. So at some point, you'll refer to daddy, and then at some point when the question comes up, you'll be able to speak to that child as to what happened to his dad or her dad.
Great advice. Great advice. This is why you're the professional, because I read these scenarios and I think, where do you even start? But we're so grateful that you're here to share with us tonight. Okay, more questions. So talk to us about, and you mentioned something about this earlier, but following the death of a close family member, should we immediately send the children back to school because it's a good distraction, keep them in a routine, or should we give them some time before sending them back?
Again, it all depends on your child, and I know I'm going to say this a lot, but children really are so different. It's not a one size fits all situation. I think for some children, a week, 2 weeks is really the max. 2 weeks is the max, because at 2 weeks, routines start to fall apart, right? It takes 2 weeks generally to establish a routine, and 2 weeks to break a routine. And so
Right.
I would suggest that if you are going to keep your child out of school because maybe they're feeling really vulnerable, or they're feeling really sad or angry or whatnot, then that you do it no longer than 2 weeks. And
Yeah.
again, if they are staying home, then they are waking up at a certain time. We're having dinner together. If that's what we do, you're going to do some reading, you're going to do your homework while you're out of school. So it's not kind of a 2 week free for all where you're going to go from no responsibility and no structure to all of a sudden all the responsibility and all the structure. Yeah, it'll
Right.
just be very jarring. So you'll do it in kind of small increments. And if you do choose to do that, I would maybe have a friend come over, or have make sure that your child is speaking to some of their friends or maybe their teachers. So kind of keep the communication. So again, it's not all in and all out.
Yeah, great. A question about after the death of a loved one, one mom is asking, should we stop at any moment visiting the cemetery because it could be traumatic for the child or teen, or do we follow their lead on that? What do you suggest?
Again, it's not traumatic unless you are forcing them to. There is nothing traumatic about death, because death, I mean, that came out, death is extremely traumatic. That came out wrong. Death is a very natural thing. So what we want to do is what is feeling natural, what is coming natural. And the
Right.
key with all of these things, the funeral, the visiting, the gravesite, all these things, is, am I having to drag my child to whatever this is? Am I having to drag my child to visit their loved one at the cemetery? If
Yeah.
that is the case, then no, that is probably
Yeah.
not a good idea.
Yeah.
Which means you might be going there by yourself. And this brings me to another point that I did want to make, is that we do not want to use or rely on our children to soothe us, right?
Mm.
We
Mhm.
want to be able to
Mhm.
soothe ourselves, and we want to be able to create time for us to grieve, but we
Right.
don't want them to be the ones that are soothing us. It might
Mm.
happen once in a while, because you might
Yeah.
see something that makes you cry, and then you think, well, I'm sad, and you can tell them, I'm sad because this reminds me of mom. In that moment, it's okay.
Yeah.
But if
Yeah.
they are your go-to soothing person,
Yeah.
that's not
Not
healthy.
healthy.
So this thing
Yeah.
where I want to go to the cemetery, but I'm going to be sad, so I'm going to take my child. No, we don't want to do that.
Yeah. Yeah. Okay, that's good. That's really good advice. Great. Wow. So much here. I do want to shift gears a little bit now, and then we may circle back. But, we've talked a lot about the grief in terms of death, but let's talk about divorce and, broken relationships, because there's so much grief and loss attached there too. Can you just maybe you want to dive into that? But just talk to us about, how do we explain divorce to children? Do we treat it the same way as death? Like, how do we have that conversation?
Yeah. So, I mean, I guess it depends on how the divorce is going. But no, I mean, divorce is a restructuring of the family. We do not treat it as death. Now, there may be, there are aspects of it that are grief inducing. So you might expect the same stages exactly, and especially that 1 year stage, right? It's going to be that first year are all the anniversaries, and this is why that first year in grief is the most difficult year, because we go through all the anniversaries. We go through the person's birthday and they're not here. We go through our birthday and they're not here. We go through Christmas or Hanukkah, or we go through Easter and all these, Thanksgiving, all of those things. And that's, the family now has to find different ways to do rituals and things like that. And that's what happens the most with divorce. So with divorce, you do want to talk to your children about divorce in a direct, simple, and thoughtful way. You want to try to minimize kind of the personal injury to the other person. There might be a lot of anger. There's usually a lot of anger in divorce. We want to be able to manage that anger internally ourselves, or manage it with a therapist, or manage it, help with a friend or something. We don't want to put children in the middle of a couple, of a divorce. We don't want to use them as pawns or anything like that. But once the divorce has happened, we want them to know that where the other, whatever parent they're living with, or however the custody agreement is at this point, where is that other person living? Are they going to be able to visit the other person? How often? So really give them the details and the facts. But no, I mean, it is not a death, and yet there is going to be a grief process, because the family now looks different, obviously.
Right. That's really good. Hard things that we're all walking through in different ways, what would you advise to someone who, maybe they have, one of the examples that we received was, the daughter is turning 13, but the dad hasn't been in her life since she was 8. Now all of a sudden he's kind of coming back around, wanting to be in her life, but the daughter's very angry and, not interested. How would you encourage that mom with that daughter?
Yeah, so I mean, if the mom is thinking that the relationship with the dad is a positive thing, then really we've got to talk to that dad and say, you've got to be patient, right?
Yeah.
The dad here is charged with being patient, and so
Right.
maybe trying to guide the dad, like, why don't we start with maybe a phone call once a week, and then maybe we go to a FaceTime, once a week, or 2 phone calls a week. Like, we have to get this dad to understand that he cannot just pop in and be all in,
Right.
that it has to be kind of a gradual introduction, so that she also feels like she has some control, because at that age she needs to feel like she has some control,
Right.
and again, she's going to be doing a lot of the push pull, but there's also a fear, which is, as I'm sure you can imagine, a fear is, if I open up and let him in, how what guarantees are there that he's not going to hurt me again? So helping her write a letter to your dad. Why don't you write a letter to your dad about why you're so angry? Or and I will give them a prompt. I'll say, let's write a letter, and the letter will begin like this: Dad, I'm angry with you because.
Mm.
Just let her go with it.
Yeah.
Let her go with it. And then at the end, she can tell us, do you want us to give the letter to dad? Do you want me to read the letter? Do you want to, what do you want to do with this letter? But really, just writing the letter is going to help her get it out. And I don't want her to type it. I want her to write it, because she'll connect. We connect with our words when we write them, and just writing them is going to help her process her emotions and her feelings.
That is great advice. Great advice. What would you say to maybe a similar situation, but different in that, dad is very much alive, but just not present and doesn't want to be, and that grieves the child, that grieves the mother for the child. Obviously, what would you
Yeah,
suggest
yeah.
there?
Yeah, I mean, I will tell you this. I have worked with many people in this kind of comes back, in our early 20s and 30s, when we're really kind of trying to establish ourselves as adults. There's this injury of abandonment, right? And it affects our self-esteem. So the biggest thing with children that are going through that is that we want to really build up their self-esteem, and we want that child to know that your dad is not here, but he's a poopy head, right? That's
Mhm.
that's that's his malfunction, that's his issue, and it has nothing to do with you. He's not
Right.
here because he's got stuff. I call them poopy heads, you know, but you're awesome and he's missing out. He's missing out, you're incredibly lovable. Also really build up that child's self-esteem, with things again that are truthful and that are honest, and that
Mhm.
you try to explain to that child that the reason that that parent is not present is because
Yeah.
they have stuff going on that is
Right.
beyond them even.
Right. Yeah, that's good. That's good. Yeah, and we received another question similar, which I'm sure you'd probably say a similar thing. But child is 5 years old. Mommy, like I miss Daddy. I want to see him. And the mom's like, what do I say to this child? Because like you're saying, you don't want to wound the child and then think I'm the reason why Daddy is not here, because it's certainly not the case.
No, no. And so with a
Build
child like
that
that,
connection.
with a question like that, you might even say, you want to reflect, right? And
Yeah,
so what you don't want to do is say, oh, you don't have to miss him. Why don't we do something together? Or why do you
yeah,
miss him? There's no reason to miss him. You don't want to do that. So you
yeah.
want to do something like, so you miss Daddy, huh? So if Daddy was here, what would you want to do with Daddy?
That's
And
good.
you might do this and that. Yeah. And what do you think would be happening if Daddy was here? What would he be doing? Oh, he might be doing this and this. And so let the child engage in a little fantasy of what might be happening if Daddy was here. And then
Mhm.
at some point say, well, maybe we could do something like that. Do you
Mhm.
think you'd like to do something like that with me? Right? Do you think you'd like to go to the whatever dog park with me? Oh,
Right.
okay.
Right.
And go, right? So let the child express themselves, let them have a little bit of fantasy, and that may be hard for us to ask, what would you do? We sometimes think that's
Yeah.
hurtful, but it's actually not, because it allows the child to kind of express what it is that they want Daddy for, that they're missing Daddy for. And then we try to see if there's
Yeah.
anything that we can maybe try to do that might fit in that, the square peg, maybe we can put a little round peg in that one for today.
That's great. I think that's the nugget for tonight I'm taking with me just for all of my, interpersonal relationships with my children, is just to not deflect, but to reflect what they're saying.
Yes.
And then you kind of
Yes.
have the skills later to redirect the conversation to a way that's appropriate. That's my nugget for
Totally.
the night. Thanks for that,
Yeah, because
Clara. Um,
yes, we have an impulse to say, "Oh, don't feel like that," or "Don't think that," and then immediately it shuts them down.
Right, that's right. I'm guilty of that with my daughter. Even if she says, sometimes I catch myself, she'll say in her room, "I'm scared." And I'm like, "Oh, don't be scared." And I'm like, "No, no, 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 no." I should say like, "Well, what are
Right,
you scared of?" And then we're able to talk it
right,
through. So that's
right.
a really great tip. I'm looking at our time. Goodness, we could keep going for hours because this is such a loaded, important topic. Let's see, we've got about 5 more minutes. So I want to do a kind of a blitz round to get through a few more questions with you, Clara. But let's talk about the loss of a job. So that's another type of loss. And a lot of people have faced that this last year. How much
Yeah.
should we, be honest with our children about that?
Well, that one depends on what age the children are and how much they are going to notice that there is a job loss. And again, oftentimes it's better with younger children to wait for the question. So let's say if somebody has lost their job, they're going to be home a lot more, and so at some point the child's going to notice and say, "Daddy, you're late for work."
Right.
Right? And so at that point, or "Mommy, you're late for work." At that point, you might say, "Well, Mommy doesn't work for that company anymore. That company went through some difficult times, and so Mommy just doesn't work for that company anymore." That's really all we need to say,
Right.
kind of at that level of age. With older children,
Yeah.
10, 11, 12 and up, kind of the tweens, and because kids are getting just, they hear so much more, and they're so much more kind of, I think, in the know these days. You want to let them know. You want to let them know, I've lost my job. I don't work at this company anymore, but everything's going to be okay. And that part is so
Yeah.
important, right? The this is I don't we don't want you to worry. We know you're going to, but just so you know, we are taking care of it. And there's nothing that you need to worry about, because children immediately, they're so egocentric. They're like, "Oh my God, what is my role in this? Are we going to lose the house? Are we going to lose the car? What's going to happen?" And so
Yeah.
it's, this happened and things are going to be taken care of. I'm on it. Things are going to be okay. That part is really, really important.
Yeah.
Now that just real quick, that might lead to, we may need to spend a little less. And so it might, again, affect them. And so you tell them kind of as you need to, again, in very simple, direct, and thoughtful language.
That's great. That's great. Um, And I do want to say to those of you listening
Don't
in,
hide it from them.
exactly. That's great. For those of you listening in, or maybe you're listening to this thinking, man, I want so and so to hear this, or my spouse or someone else. These are all going to be recorded, and they will be available on jacksonevents.org. So you can go back and listen to previous webinars, and then give us 10 days or so, and this one will for sure be up there, jacksonevents.org. So you can go back and watch the recording. So don't worry, this resource will be available for you. Okay, quickly, if you're okay with the time, I'd love to, if we can extend maybe just 5 or 6, 7 more minutes. There's a few more questions I think are important to get to. Let's talk about the loss of a pet, because we can feel like it's trivial, but it can be very huge for children and for adults alike. Is it okay to tell a little white lie about what happened to a dead pet? I'm thinking about when we lost a fish when my daughter was 2, and I'm like, I don't want to talk to you about the death of a fish right now, but what's a good way to deal with that with children?
Again, I mean, and I may be an outlier on this one, but again, I just kids, they know when we're not telling them the truth,
Yeah.
and you would not believe it, but trust, the trust that we build with our kids come by, from what we do, from them knowing that we're going to take care of them, but also what we say to them, right? How we treat them. And you would not believe, in the treatment of adults, how many times people say, they lied to me about my pet fish, and then I knew I couldn't believe them. So if this is an opportunity for us to begin to tell them again about life, right? When we talk about death, we talk about life. We talk about, we all kind of have a bit of an expiration date.
Right.
And so I would suggest, don't lie. Don't do the, Fluffy went to the farm, because they are going to wait up for Fluffy. They're going to want you to show them on the map where the farm is. Just be as direct as you can possibly be. If you can have a little ritual to say goodbye to the pet, that's perfectly fine too. And wait a little bit of time before you replace the pet. So sometimes parents feel like, Fluffy died, but here's Muffy, and Muffy's going to be
Yeah.
just as good as Fluffy was. We don't want to do that.
Right.
We don't want to do that. We want to give it a little bit of time, and just give them a little bit of space to feel how they feel. And again, they might be fine. You might be more mortified than they are.
That's it. You nailed it, because I was honest about the fish. I said he died, and she said, "Well, where did he go?" And I'm like, I flushed him down the toilet. And I said it, but it was like, it was more uncomfortable for me. And I know this is a silly example, but I think the lesson in it for us is sometimes it's more uncomfortable for us, but it's always, I think, better to tell our children the age appropriate truth, as you've been saying. So this is great information. Okay, a couple quick more questions. Let's talk about, are there any books that you recommend, like children's books that you recommend that appropriately explain death or loss for kids?
You broke up on that one. Could you ask that again, please?
Yes. Are there any books, like children's books, that you would suggest or recommend for death and loss?
There are. I mean, you can find a book, if you just do a simple Google search, there are books, there are workbooks, there's all kinds of stuff. But there is one book, it's kind of the granddaddy of books for grieving, and it's called The Invisible String. It's a really lovely, very well written book. So
Okay.
I would suggest that, but really do, for each of you, again, do a Google search, know your child, and don't become overwhelmed with overwhelming your child with information.
Okay.
I think sometimes the book is a great idea. It can be great, but it can be just easier and simpler for you to just explain things yourself. I think, if anything, buy the book, read it yourself, and the book
Yeah.
will give you the language that you need to talk to
Good.
your children without the book. Yeah.
Good. That's great. Good tip. Okay, shifting back a little bit to like the death of a family member, but here's a question that this person's children's grandmother, who they're very close to, is terminally ill, and this mom, wants to take them to spend as much time with her as possible, but afraid that is it going to make it harder for them in the long run? What's your recommendation? Should they limit time together with her?
No, no. Having the ability to kind of prepare to say goodbye, to have some time to say goodbye, is actually a really lovely thing. It's a luxury in the concept of grief and death and dying that we sometimes don't get. But I will say this, going to hospitals can be scary. And
Yeah.
so do talk to your children about what to expect. Similar to the funeral, talk to them about what to expect if grandma looks different, if she's thinner, if she's lost her hair, things
Right.
like that. And then also continue to ask them, right? Do you want to go? Because maybe I mean, at this point, hospitals are kind of different, but would how do you want to talk to grandma? Do you want to talk to her on the phone? And also, it's okay to tell them, right? And grandma must be on board with this, right? To know that, yeah, I mean, grandma may be passing. She's terminally ill. She may not recover, and so we're doing this. We can take pictures. Really take this opportunity to remember her in the way that we want to remember her. So it's actually a really lovely opportunity that not everybody gets in their grieving. So no, do not try to protect or shield children from that. Just be age appropriate.
That's great. Yeah. And like you said, that is a luxury to be able to have that
Yeah.
time together. So that's great.
Yeah.
I think maybe final question, but tell us about, and this one question in particular says that they overheard their son talking about death to their friends in an innocent way based on the loss that he'd experienced. Should we
Mhm.
discourage that or just kind of stay out, like as children engage with one another, I guess, about grief and loss?
Yeah. I think what we want to be mindful of is that they're not saying things that are necessarily inaccurate, like, oh, yeah, my grandpa died, but he's coming back. So at that point, and you don't want to do it in front of the friends, unless you kind of
Right.
have time to sit down with all the friends, but really just listen for the information. And if you feel that whatever your child is talking about is not necessarily accurate, or it sounds to you like they're not understanding exactly what
Mhm.
happened, then you want to kind
Yeah.
of circle back to that at a different time when they're not with their friends, and just give them the proper information. But it's perfectly fine for them to talk about it with their friends. Perfectly fine. Again, they have community too. That's their community.
That's right. Oh, that's beautiful to think about. Yeah, our children. And like you said, we all have the same, what's the word, I guess, diagnosis that in the end we're all going to face death. It is a natural part of this rhythm of life. And
Right.
so it's a skill I think that we have to get savvy on to work with our children through this and even ourselves. I mean, some people can grow very old before they ever have to experience this, but we're all going to experience it at some point. And so to be equipped with right language, right, directing conversations and whatnot is so important. And Clara, you have helped us so much tonight. We're just so grateful. I think I speak on behalf of everyone who's listened in tonight, that we're encouraged and thankful. And again, I just want to take a minute, everyone that's listening, just to say that our hearts, our prayers, our thoughts are with each and every one of you, wrestling with everything from loss to divorce to miscarriage to advocating for your children when it's challenging. So many things can cause grief and loss for us very personally. And so it is our heart that resources like this would be so helpful. And so I can just say for sure, Dr. Laura, thank you for being with us tonight. And we just appreciate you so much. Again, here's some resources for you all on the screen. You can take a screenshot of this. You can visit childmind.org later or childrengrieve.org. Again, all of the webinars will be available at jacksonevents.org. So you can go back and watch previous ones. I do want to go ahead and make a plug for 2 weeks from today. Go ahead and mark your calendar. 2 weeks from today, 8 p.m., we're going to do a parental guidance about nutrition for kids. So we did this last, I guess it was fall. It was a hit. It was one of our most exciting ones and well attended, but we're going to do part 2. So we're going to talk about nutrition myths and provide some snack tips, as well as how we can equip you to not feel overwhelmed when you're building healthy meals and habits for your family. So plan to join us for our next edition on March 11th. That's in 2 weeks. But thank you again to Dr. Laura Spina. Thank you again to Jackson Health. UHealth Jackson Children's Care. Again, that ER is available for you all the time. And also Dr. Laura Spina, I mean, they can reach out to you. You're obviously doing great work at Jackson with, the internship program, among other things, but I know you have your private practice as well. So I'm sure they can reach out and find you. But thank you again, those who listened in from really all over the world. We got Nicaragua and Bahamas and all over Miami. So thank you again. And we wish you all a great, great evening. Good night,
Thank you.
everyone.
Good night.